Well, hello there. In today's video, we're going to talk about Medicare 101, Medicare for 2025. We're going to break it all down. We're going to go over what is original Medicare, what is a Medicare Supplement, Medicare Advantage, and the costs associated with 2025. And we're going to give you the do's and don'ts of Medicare as well. So that way you don't have to worry about getting penalized or anything like that. We're going to have you covered in today's video. This video is perfect for anyone that is new to Medicare or want to just know the changes for 2025. Let's get right into it. First, before we could even talk about Medicare Supplement, Medicare Advantage, we need to understand why we even need a supplement plan or a Medicare Advantage plan in the first place, okay? So let's talk about original Medicare. Original Medicare has two parts, okay? Original Medicare is health insurance for individuals that actually earn this benefit. So if you work in the US and you work for 10 years, 40 quarters, and you paid Medicare taxes, well, you earn Medicare. This is health insurance for individuals turning 65, or if you have a qualifying disability and you have enough working credits and you get SSDI and a qualifying disability, like I said, you will automatically get Medicare after 24 months, okay? So let's say you're turning 65 and you worked in the US, got your, your Medicare credits and all of that. You're going to apply for Medicare if you're going to retire from work. We'll talk about employers coverage as well in today's video. So Medicare has two parts. So you have your Medicare Part A, which is your hospital coverage, and you have your Medicare Part B, which is your medical coverage. First, let's start with Medicare Part A. So remember the letter H when you're trying to remember what Medicare Part A covers, because it covers hospital coverage. So hospital coverage, home health, hospice, and skilled nursing home care as well. Now, it does not cover long-term care. It covers skilled nursing home care. There is a difference. Now, let's talk about Medicare Part B. Medicare Part B covers your medical, your doctor visits, your labs, your x-rays, your diagnostic procedures. It also covers medications taken at your doctor appointments, okay? So if you're getting an injection or you're getting IV medications or chemotherapy, that would be covered under Medicare Part B. So like I said, Medicare Part B is going to cover your medical coverage, such as your doctor visits, x-rays, labs, diagnostic procedures, durable medical equipment, ambulance rides, and such. And don't forget the medications that you take at your doctor appointments, such as flu shots, vaccinations, IV medications, injections, chemotherapy, and such. So with Medicare Part A and Medicare Part B, you have Medicare. There's other parts of Medicare as well, such as Medicare Part D. Medicare Part D is your prescription drug coverage that you take at home, prescribed by your physician. So far we talked about Medicare Part A, which is your hospital coverage, Medicare Part B, which is your medical coverage, and Medicare Part D, which is easy to remember, D for drugs, prescriptions taken at home, prescribed by your doctor. So how much does Medicare actually pay? Medicare covers 80%, leaving you behind 20%. So you need to be covered from that 20% because there's no max. There's no protection when it comes to original Medicare, right? 20% of $1 million medical bill is a lot of coins. That's a lot of money, right? So we want to protect ourselves from that 20%. Before we talk about the protection from the 20%, let's talk about the cost of Medicare. So let's start with Medicare Part A monthly premium. Believe it or not, you paid for Medicare Part A when you was paying Medicare taxes. So when it comes to Medicare Part A, the monthly premium is zero for most individuals. So if you pay Medicare taxes, you have your 40 quarters, your 10 years, then you don't have a Medicare Part A premium. However, with Medicare Part B, there is a premium. The premium for 2025 is $185 per month, okay? Now, there's some ways to get rid of that monthly premium, and we'll talk about that later on in today's video. But just know that Medicare Part B premium is $185 for most individuals per month in 2025. Now, some individuals will pay more than the regular Medicare Part B amount. Why is that? Because there's something called the IRMAA chart. And the IRMAA chart basically tells you how much your monthly premium would be for Medicare Part B based on your adjusted modified income. And it goes back 2 years. So it's going to look at your income for the past 2 years, and it's going to tell you what is your actual Part B monthly premium is. We're going to put the IRMAA chart on the screen, and let's take a look. So if you look at the IRMAA chart here, like I said, this is based on your modified adjusted gross income for the prior 2 years. So for an individual tax return, so this is for an individual that filed taxes on their own, not joint. So if you made $106,000 or less as an individual person, then your Part B premium, according to IRMAA, would be $185 per month. Now, if you filed jointly and you made $212,000, then you will also pay $185 per month. Now, let's look at individuals that make $106,001 to $133,000 as an individual. This individual would pay $259 per month for Part B, and you will also pay $13.70 for Medicare Part D. So if you are married and filed taxes jointly and made $212,001 to $266,000 for the year, then you will also pay $259 per month. You would pay that, and your spouse would pay that as well, okay? And each of you guys will also pay $13.70 per month, okay? So you always want to look at the IRMAA chart. If your income is over $106,000 as an individual or over $212,000 as a joint filer. So if you make more than that, then you will pay more than the average Part B premium. That's our IRMAA chart. Like I said, you will look at the IRMAA chart and determine what is your monthly premium for Medicare Part B, and if you have a monthly premium for Medicare Part D. Also keep in mind that once your income decreases, you can notify Social Security so that way they can make the proper adjustments. They will look back 2 years. So once the 2 years has passed and your income have dropped, then you can notify Social Security so that way they can make the proper adjustments so you could pay the regular monthly Part B premium amount. So that is definitely a tip that you want to keep in mind. Now let's talk about Medicare Part A deductible. So Medicare Part A don't have a monthly premium, but Medicare Part A does have a deductible as well. And this is not per year, it is per benefit period. So if you get admitted to the hospital, you have to pay this deductible. And for 2025, it's $1,676. However, I do want you to take note that if you have a Medicare Supplement plan, the Medicare Supplement plan will pay your Part A deductible for you, and we will talk about supplements later on in the video. So now we're talking about Medicare Part A premium, and we talked about the Medicare Part B premium. Let's talk about the annual deductible there is an annual deductible for 2025. It's $257, okay? So you will pay this deductible before Medicare will kick in and pay its portion. So what is a deductible? Well, I kind of just said it. A deductible is the amount that you have to pay before the insurance actually pays, okay? So say you go to the doctor in January and his bill is $150. You would go ahead and pay that $150 until you reach your annual deductible of $257 in 2025, okay? And the annual deductible does change year after year. So that is the annual deductible for 2025, $257. Okay, so let's talk about when should you enroll in Original Medicare, okay? So when you first turn 65, you have a 7-month window to enroll in Medicare on time. You do not want to delay Medicare, because if you delay Medicare, then you will be penalized for not having Medicare Part B. You will also get penalized if you don't have prescription drug coverage as well. So like I said, there is a 7-month window that you can enroll in Original Medicare. You have 3 months before you turn 65. You have the month of your 65th birthday, and you have 3 months after you turn 65. We highly recommend that you enroll in Medicare 3 months before you turn 65 to prevent any delays, okay? So how can you enroll in Medicare? You could go to ssa.gov, create yourself an account, and from there you could go ahead and apply for Medicare, and you could also apply for your retirement benefits as well. The application takes about 10 minutes or less, okay? Or you could go to the Social Security office, your local Social Security office, and apply for Medicare there, or call the 1-800 number, and we'll leave the 1-800 number right here, and set up an appointment for you to go ahead and enroll in Original Medicare. So Medicare, like we said, covers 80%, leaving you behind 20%, right? So let's talk about what can we do to help you with that 20%. You do not want Original Medicare alone due to this 20%. So there's 2 routes you could go to help you with this 20%. The first option we're going to talk about is a Medicare Supplement plan. So the Medicare Supplement plan will actually pay the 20% for you, and it will also pay your Part A deductible as well, and we will break it all down, okay? So let's talk about the pros of a Medicare Supplement plan. So some of the pros of a Medicare Supplement plan is that you don't have to worry about the 20%, obviously, because it follows Original Medicare. So Medicare will pay the 80% of your bill, and the supplement will follow and pay the 20%, which is really nice, giving you 100% of coverage, okay? Now, with a Medicare Supplement plan, you don't have to worry about pre-authorization. As long as it's a service that Original Medicare covers, the supplement will follow and pay that 20%, okay? So you don't have to worry about pre-authorization. You don't have to worry about asking the insurance company permission to approve a test or a procedure or whatever the treatment is. As long as Original Medicare already said yes, then the supplement will follow and pay the 20%. Also, with the Medicare Supplement plan, you don't have to worry about doctor networks, okay? As long as the doctor takes Original Medicare, they will take your supplement as well. So with Original Medicare and a Medicare Supplement plan, together you have 100% of coverage. Like I said, Original Medicare covers 80% of the bill, and the supplement will come along and pay the 20%. Another pro of having a Medicare Supplement plan is you could travel within the U.S. So you could be in New York for 6 months, Florida in 6 months, Hawaii for 6 months, okay? And as long as the doctor takes Original Medicare, like I said, it would take the Medicare Supplement. Doesn't matter where you are in the USA, okay? So that is nice that you can travel with a Medicare Supplement plan. Now let's talk about the one con. The one con is, can you afford a Medicare Supplement? Remember, you have to pay Medicare Part B. You need drug coverage as well, so you have to pay your Part D monthly premium. And now you also have to pay for that Medicare Supplement premium as well. However, a Medicare Supplement is worth it, okay? It is definitely worth it. It definitely gives you that peace of mind that you are going to be taken care of, and you could choose any doctor that you want to choose as long as that doctor is accepting new patients, of course, right? So a Medicare Supplement plan is definitely worth it. Now, let's talk about some more cons with a Medicare Supplement plan. You do have to get a standalone drug plan as well. Prescription drug coverage is not included within a Medicare Supplement plan. So you do have to get a standalone drug plan even if you're not on any medications, okay? Another con of a Medicare Supplement plan is that it only covers what original Medicare covers. So you're not going to be able to get a Medicare Supplement plan with dental, vision, and hearing. If you need these benefits, then you will have to get a standalone plan. But other than that, a Medicare Supplement is a great option. Now, who is a great individual for a Medicare Supplement plan? Number one, if you could afford it. If you could afford a Medicare Supplement plan, then it may be the perfect option for you. And also, if you don't want to have to worry about pre-authorization, you don't want to have to worry about doctor networks, then a Medicare Supplement plan may be the perfect option for your situation. When is the best time to enroll in a Medicare Supplement plan? The best time is when you first turn 65 and you're eligible for Medicare, or when you retire from employer's coverage, okay? Because when it comes to Medicare Supplement plan, there is something called underwriting. Underwriting is when you have to answer a series of health questions, and if you say yes to any of these questions, then your application will be denied. However, when you first turn 65 or when you're getting off for employer's coverage, you do have a 6-month window where the insurance company cannot ask you any health questions. So if you have dementia or Parkinson's or diabetes with complications and such, or you have a family history of certain chronic diseases, then a supplement plan would be the better option for you, because you don't have to worry about if something happened to you in the future. You don't have to worry about going through underwriting with a Medicare Supplement plan and getting denied. So the best time to enroll is when you're first eligible for Medicare, okay? Because you don't want to have to worry about underwriting and such. So definitely take this in mind, your monthly budget and your family history, health history, and your health history as well. Okay, so you definitely want to consider that when you're deciding if you want to get on a Medicare Supplement plan. But like I said, a Medicare Supplement plan is a great option. Now let's look at the Medicare Supplement chart. This chart is going to show you what is covered. Like I said, a supplement plan is going to follow original Medicare, and we're going to talk about Medicare Supplement Plan G versus Medicare Supplement Plan N. All right, so before we look at the chart, I do want to make this disclaimer, okay? All of these Medicare Supplement Plan companies have to cover the same. So they all give the same coverage, okay? These plans are standardized, okay? They're standardized by the government. Like I said, they follow original Medicare. So whatever Medicare does, it pays the 20%. All of these companies, like I said, are the same. The only difference is the monthly premium of these companies. So it's very important to work with a broker that understands the market. You want to go with a Medicare Supplement Plan company that has a rate history, that gives steady rate increases, and that they're stable in the market, because that's very important. You want to go with a company that is stable in the market, has a lot of the market share, Because if you have a lot of market share, you have a lot of individuals on your plans, and you've been around for 20 plus years, then you're pretty stable as a company. So you don't want to go with the first Medicare supplement plan company with the lowest, cheapest rates. They've been around for a few years. They can't maintain it, and then they have to jack up the rates for their members. So it's very important to work with a broker that understands the market and understand how these insurance rate increases work. So history of these companies is very important, is very key. However, this information is not open to the public, okay? So we have this information. So if you need help, we will be more than happy to help you. Let's look at the chart. Let's talk about the Medicare Supplement insurance, also known as Medigap plans. Let's go over the benefits. As you can see, these plans are categorized by letters. So you have Supplement Plan A, B, C, D, F, G, K, L, M, and N. The most comprehensive plan is Plan F because Plan F pays your Part B deductible. However, Plan F cannot be sold to anyone turning 65 after January the 1st, 2020. So if you turn 65 prior to January the 1st, 2020, then you can purchase a supplement Plan F. After 2020, you cannot purchase Plan F. Okay? The next comprehensive is Plan G. After Plan G is Plan N. Now let's go over the benefits. Your Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used are covered at 100% under Supplement Plan G and Plan N. Your Part B coinsurance or co-payments is covered 100% under Plan G. Plan N has co-pays, okay? Your blood benefit, your first 3 pints, is covered at 100% for Plan G and Plan N. Your Part A hospice care coinsurance or co-payments is covered 100% under Plan G and Plan N. Your skilled nursing facility care coinsurance is also covered at 100% under Plan G and Plan N. Your Part A deductible is also covered 100% under Plan G and Plan N. Your Part B deductible is not covered under Plan G or Plan N. I'm going to repeat it one more time. Your Part B deductible is not covered under Plan G or Plan N. Okay? Your Part B excess charges is covered 100% under Plan G. However, Plan N can have excess charges. Your foreign travel emergency up to plan limit. So there are some limitations when it comes to foreign travel, up to 80% covered under Plan G. Same thing with Plan N, covered up to 80%. Now let's talk about the difference of Medicare Supplement Plan G and Medicare Supplement Plan N. Okay, so Plan G is going to cost more than Plan N because Plan N has copays, okay? So the difference is Plan G and Plan N both does not cover your Part B deductible. So you would have to pay the $257 deductible in 2025. Now, when it comes with a Plan N, there are some additional copays, okay? So you'll pay your monthly premium and you will pay copays as well, up to $50 for a ER visit and up to $20 for a doctor visit. And also with Plan N, there's something called excess charges where the doctor can charge up to 15% more than original Medicare. So if the doctor wants to charge you up to 15% more, then you will have that additional cost as well. Now, however, I want to put out a disclaimer that not all doctors charge excess charges, and in some states, excess charges are not allowed. But that is the difference with Plan G and Plan N. Plan G is more comprehensive. Plan G will cost about $30 or so more per month because Plan G does not have copays. So that's the difference with Plan G and Plan N. So with a Medicare Supplement plan, prescription drug coverage is not included. So you also need to enroll in a standalone drug plan as well. Now let's talk about Medicare Advantage plans. Medicare Advantage plans is your second option if you cannot afford a Medicare Supplement. I recommend that you at least do a Medicare Advantage versus just staying on original Medicare and paying that 20%. So let's talk about how the Medicare Advantage plans work. So typically, a Medicare Advantage plan, monthly premiums are usually going to be $0 per month. How is that even possible? So what happened is Original Medicare pays these insurance companies to take on your risk. So different insurance companies will have or offer these Medicare Advantage plans. So they get about $1,000 or so per month for each member because they're taking on your medical risk. So most of these Medicare Advantage plans, also known as Medicare Part C, are usually $0 per month. However, you still have to pay your Medicare Part B premium unless you qualify for Medicaid. Medicaid will pay the Part B premium for you, or if you decide to enroll in a Medicare Part B give back plan. A give back plan will put money back into your Social Security checks. However, I always tell my clients to always compare a give back plan with a regular plan because 9 times out of 10, the copays are much higher for a give back plan, especially for days in the hospital. So it's very important to look at that if you do want to enroll in a give back plan. Quick disclaimer, okay? So now let's talk about the Medicare Advantage plan in a whole. Like I said, the monthly premium is going to be $0 per month, and you're going to have share of cost. So you're going to also pay copays as well. Instead of being responsible for that 20% that Medicare leaves behind, you will pay copays, okay? So the insurance carrier will pay a portion and you will pay a portion as well. So let's talk about some examples of some copays. So usually the copays will go a little something like this. Obviously, it depends on the plan, your location, and such, okay? These are just examples. So for a primary care doctor visit, that could be a $0 copay. A specialist visit could be a $20 copay. If you visit the emergency room, that could be a $50 copay. Urgent care could be $15. X-rays could be $100. Diagnostic procedures could be $185. Days in the hospital could be days 1 through 5, $295 per day. So like I said, it really depends on how often you use the plan, what you're using the plan for, based on your actual copays. So we call this pay as you go. Like I said, usually there's no monthly premiums, but you do have copays with a Medicare Advantage. Now let's talk about some pros of a Medicare Advantage plan. Now these plans are all in one, okay? So it's going to have Medicare Part A, Medicare Part B, Medicare Part C, which is the Medicare Advantage plan itself, and Medicare Part D. So a lot of these plans will include your prescription drug coverage, okay? So that is really nice when it comes to a Medicare Advantage plan, that they're all in one. Also, a lot of these plans will come with extra perks and benefits, such as dental, vision, hearing. Sometimes these plans will have transportation. If you have a chronic condition, you may get groceries. If you have Medicaid, you can get groceries as well, called healthy food allowance. So yeah, the Medicare Advantage plans can have a lot of perks and benefits and such. So a lot of individuals like the Medicare Advantage plans because it's an all-in-one package. Let's talk about a few cons when it comes to Medicare Advantage. Con number one is doctor networks. Now, this may not be a big deal if you have one doctor or if all of your specialists take a Medicare Advantage, then it's really not a big deal. But sometimes it can be a big deal for some individuals that you do have to stay within doctor networks, okay? There's two main networks. You have your HMO and you have your PPO. First, let's talk about an HMO. In HMO, you need a referral to see a specialist. However, with an HMO plan, you tend to get more benefits such as more dental, vision, and hearing. And your copays are a lot less than a PPO plan as well, okay? And with an HMO, you must stay within network. If you see a doctor, a provider outside of the network, you will pay full costs, okay? However, if it's an emergency situation, it's a true emergency, then the insurance carrier will pay for that visit, such as you go into the emergency room and you're seeing a doctor in the hospital that's not in the network, and it's an emergency, then the insurance carrier will pay the costs. Do not go in the hospital for a cold and call it an emergency, okay? Because that's not going to work. The insurance company is going to look at the progress notes, look at the hospital records with a fine-tooth comb to make sure it was a true emergency. So be careful with that. You do have to stay within network with a HMO plan. Let's talk about a PPO. Now, with a PPO, you do not need a referral to see a specialist. So if you don't want to have to worry about getting authorization for a referral, treatments may be delayed and all of that, then a PPO plan might be the best option for you. With a PPO, you can see doctors outside of the network. You will pay more for these doctors. However, you don't have to worry about a referral, like I said. However, with a PPO plan, the copays tend to be a little higher than the HMO, and a lot of times the benefits are less as well. So you get less dental, vision, and hearing benefits with a PPO plan. But like I said, if you don't want to have to worry about referrals and such, and you just want to call up the doctor and say, do you take my PPO? You don't want to worry about a referral, then a PPO may be the better option for you when it comes to a Medicare Advantage plan. Now, let's talk about this con. It's very important to take this note, and this is pre-authorization. Sometimes, in some cases, the insurance carrier will say no to a certain test, treatment, lab, procedure. You may have to go through pre-authorization to get something approved. For an example, say you're out in the yard and you hurt your hip, and your doctor say you need to have surgery on that hip. Well, the insurance company could say no. They could say try therapy first. You may have to go through hoops to get that approved so you can have that surgery. So that can be a pain with certain procedures, tests, and such. You may have to get pre-authorization, and that can delay treatment. So it's very important to take note when it comes to a Medicare Advantage plan that sometimes you may have to go through pre-authorization. Now let's answer some frequently asked questions. So can you delay Medicare? You can delay Medicare if you have employer's credible health insurance coverage, okay? So you have to have employer's health insurance coverage, 20 or more employees at your job. If you have health insurance through your job, like I said, 20 or more employees, then yes, you can delay Medicare. If you want, you could go ahead and just enroll in Medicare Part A, since Medicare Part A does not have a monthly premium, and delay Medicare Part B, or you could do nothing at all and just stay on your employer's coverage until you retire. Once you retire, then you definitely need to go ahead and enroll in Medicare within 2 months. Do not go past 2 months without Medicare. You will be penalized, okay? Now, you cannot delay Medicare if you have marketplace health insurance, also known as Obamacare, if you have private health insurance, and if you have health insurance through the Christian-based programs, right? The Christian-based cost share insurance plans. You cannot delay Medicare Part B. These insurance plans is not considered as credible health insurance for Medicare. So you need to go ahead and get off of that and enroll in Medicare if you don't have health insurance coverage through your employer. And remember, you can also delay Medicare if you have health insurance through your spouse employer as well, and it still have to be 20 or more employees and be credible health insurance coverage. Now let's talk about Medicare Part D, prescription drug coverage. Can you skip out on a drug plan if you are not taking any medications? The answer is no. You cannot skip out on Medicare Part D unless you have credible Part D coverage through your employer, or if you have drug coverage through VA or TRICARE, okay? So if you do not have drug coverage and you're not taking any medications, you still need to enroll in Medicare Part D, your prescription drug coverage. Just get on the plan. A lot of these plans can be $0 a month or very low cost if you're not taking any medication. So you definitely want to enroll in Medicare Part D. If you're not enrolled in Medicare Part D on time, you will get penalized, okay? So you can be penalized for not having Medicare Part B on time, and you can be penalized for not having Medicare Part D on time as well. And unfortunately, if you get penalized, you have to pay a monthly premium, an additional monthly premium every single month, as long as you have Medicare Part B or as long as you have drug coverage. So you're penalized for the remaining of your life, so you don't want to do that. Now, I want you to keep in mind that our office can help you with Medicare, Medicare Supplements, Medicare Advantage, and such. So if you need any assistance, please give our office a call. We'd be more than happy to assist you. Thank you so much for watching today's video. If you liked the video, please give it a thumbs up. Subscribe to the channel if you're not already subscribed. If you have any questions, leave them in the comment section below and I'll answer your questions. And if you know anyone that can benefit from this video, definitely share this video with a friend. Thank you so much for watching, and I'll see you on the next video. Bye for now. Bye.